I'm Dr. Frank Celenza from New York City. I'm a dual-trained dental specialist as a periodontist and an orthodontist. I have many years of experience in teaching, and I was raised by a teacher to be a teacher and a clinician. And I'm always excited to share my clinical experiences with others that are eager to learn. I have a lot of experience, and I'm excited about the combined use in orthodontics with periodontal techniques such as implant dentistry and anchorage in orthodontics. And that has expanded our ability to treat case types into new realms. And pretty much that's what I was talking about, is some of the advancements on both sides, the implant side and the orthodontic side, and where that seems to be developing. In my experience in dentistry, whenever a new technique comes along and becomes successful, it tends to expand into realms and areas that we never anticipated in the beginning. And certainly that's what I'm seeing happening here as we expand aligner therapy into movements and case types that we never expected to be able to accomplish when it was first introduced. So my lecture this afternoon combined the aligner technique with the use of mini screws, which have come into vogue, to develop into new case types and treatment modalities that are very promising. Orthodontics, like the other specialties of dentistry, continue to develop and advance. My own perspective, exclusively treating adults, that's where I come from, so I see it expanding into a much greater application, becoming available to more people, more acceptable to more people, with better outcomes and more easily accomplished too. As we get into the digital realm, we're now taking digital impressions using digitally fabricated appliances with greater accuracy. There's been a much improved awareness of orthodontics, acceptance of orthodontics, and availability of orthodontics. And adults, which I used to have to convince to undergo orthodontics, are now coming to me and asking for it. So something's happening out there to open it up to the public. I'm just excited to see the continuation of these advancements, that it becomes easier to implement, easier to deliver with greater rapidity, better treatment outcomes in less time, in a more acceptable format to patients. And I think we'll continue to see that trend develop. Many of my colleagues are well aware that I'm passionate about motor racing, sports car racing, and I've been involved with motorsports virtually all my life. I consider myself a student and a historian of the sport. And last year I was able to accomplish a national championship, which I hope to defend this year. I race my Porsche in Porsche Club events around the Northeast region, which I won last year, and that qualified me for the national championships, which conveniently were held in New Jersey, near where I live, and on a track that I'm familiar with. So I was able to go out and clinch the national championship there, and that actually will be where we defend it again this year in October. So I've developed the car further, and I've continued to improve as a driver, and I think we're ready to give it a good shot. I think the guide form of education is a fantastic territory to be investigating. I'm delighted to be a part of it. It's an example of a way that we can get this information disseminated to other parts of the world, to people that we would otherwise not have met. And I'm delighted to have made friends with people in many other countries who share a passion for our profession. The guide forum I actually stumbled upon when I was looking for something of exactly that format. Being involved in other internet channels that we communicated that didn't quite fit the bill, the guide forum has the format and the ability to stay on topic and communicate with people all over the world. I've made a lot of friends, we've shared our opinions, I've learned a lot on that forum. And then it's always wonderful to actually meet the people that you've been communicating with over that time and make friends in that way. But it's just part of the worldwide advancement of our specialty.
For more education programs, visit the GIDE Institute at www.guidedental.com.